So thank you again for joining us tonight for the many shades of ALS presentation focusing on assisted living and long-term care facility needs when it comes to working with patients who have ALS. We have Kendra Womack is going to be our moderator tonight. And on our panel, we have Cynthia Marks, Darla Burge, Mickey Waller, Will Greenfield, and we lost Michelle. Oh, there she is, Michelle. Sorry, my screen went wonky. Michelle Camacho, she is one of our on our panel tonight. So I'm gonna just have everybody real quick introduce yourselves, and then I'm gonna go through just a quick presentation introducing you to some ideas, and then I'm gonna kick it over to Kendra, who will take over as the moderator. So let's start with Cynthia, if you want to just give your quick intro, and then we'll go to
Sure.
Michelle.
My name is Cynthia Marks. I'm a regional care manager with the ALS network here in Southern California, and I cover San Bernardino County.
Awesome, thank you,
Happy to be here.
Michelle.
Hi, I'm Michelle or Mickey Waller, and I'm living with ALS, PLS. I also too live in Southern California. I'm part of Cynthia Marks' support team, and former educator, retired, just living my life at an assisted living facility.
Thank you. And then Michelle Camacho.
Hello, my name is Michelle, and I'm the primary caregiver of my mom, Monica, who was diagnosed with ALS in September of 2023. And I love to research and volunteer, and my mom has been a professional volunteer for all of my life. And that's why I'm here to give you a little bit of my perspective as a caregiver for my mom at home.
Well, thank you for that. Darla.
My name is Darla Burge. I live up here in Idaho. My husband had a sporadic bulbar ALS, and he was diagnosed in 2010. He had it for 13 and a half years, and he passed away in 2023. He was a veteran, and I was his primary caregiver, and I was able to take care of him in the home right here. I'm a retired RN, and my perspective is when I was younger, I did work in a nursing home.
Awesome, thank you. And Will.
Hello, everyone. My name is Will Greenfield. I live in Washington, D.C. I was diagnosed in 2006, and in 2017, I was admitted to a nursing home. I lived there for 5 years, and currently I have my own. I moved out, and I'm living with community-based living care. So I have nursing, home care nursing taking care of me. I'm happy to be with everyone tonight.
Thank you, Will. And then Kendra.
Hi everyone, my name is Kendra Womack. I am from North Carolina. I am a part of the Many Shades of ALS team, and my connection to ALS is that I was my mom's primary caregiver until she passed away.
Yeah, thank you. And I should also mention, in addition to working for IMALS, I started with IMALS as a volunteer. I was the primary caregiver for a friend of mine who was living with ALS. And so becoming an ALS advocate became my passion and the primary driver behind all of the things that I do. So I'm very happy to be here, part of this group. It's a very welcoming and compassionate group. So thank you all to all of our panelists. So I'm just going to go through a quick presentation just to remind folks. Some of you may say, well, duh, I already know this stuff, but I just want to make sure that we cover all our bases. So give me 1 second because my computer doesn't like when I have so many things open. All right, you all can see my screen, yes? Okay, so tonight we'll just talk about what ALS is, how it's diagnosed, the different types of ALS treatments, principles for how people with lived experience, and then living with hope. So really quick, the importance of doing these panels. So this is a part of our panel series. They're called the Tim Lowry panels that we do for folks. And the primary driver behind those was Tim Lowry himself, who is a person living with ALS. He was a former pharmacist, and he saw a great need in educating the healthcare professionals that were going to be working with ALS patients due to the lack of knowledge that they get. We have heard time and time again from folks that we present to that if they get a paragraph in a textbook about ALS, that's a lot. And so we started doing these panel series for really any student, school, anybody that would have us. So far, we've done 41 of them this year, and we've reached over 1,500 participants, and that includes nursing students, physical therapy students, occupational therapy students, speech pathologists. It's a long list. And so we thought with Mickey's help, we would love to bring the same information to those folks who are either thinking about an assisted living facility and or working in an assisted living facility. So really quick, ALS, better known as Lou Gehrig's disease, is a disease that affects a person's motor neurons. It gradually deteriorates and die, causing the messages from the brain through the spinal cord to the muscles to slow down and then stop and then eventually die off. Folks that are living with ALS will go through some gradual weakening of muscles. It might start with a twitch to a time when the muscles completely atrophy or waste away. The brain then eventually loses its ability to initiate and control voluntary muscle movement. Unfortunately, there is no known cure or effective treatments that reverse the disease. We'll talk about treatments in a moment. And unfortunately, here are some fast facts that are a little sobering. So 6,000 Americans are diagnosed with ALS on an annual basis. Currently, there's over 30,000 Americans living with ALS. The lifetime risk of contracting or developing ALS is 1 in 300, which is pretty sobering. And then military veterans are twice as likely to be diagnosed than their general public counterparts. And we get questions all the time. Why is that? They're doing much research to find out why that is. There's a bunch of theories, but as of right now, there's no one reason that they have pinpointed as to why that rate is so high. Contrary to pretty popular belief, ALS does not just affect white folks, it affects people of all races and all genders. And so I have heard so many times that ALS is referred to as an old white man's disease, and we're here today to show you that that is not true. Unfortunately, ALS is not discriminatory. A couple of the things that you'll see tonight and maybe hear about are the way that disease progresses. We'll talk a little bit about that. Approximately 35% of people living with ALS will develop some cognitive or behavioral impairment, but in general, ALS does not affect a person's ability to think, which is great. And then we are doing lots of research on the environmental and genetic causes leading to ALS. There are two types of early symptom onset. The first is called limb onset, and it quite literally starts in a person's limbs. It might start in their arms or their legs, might start with small muscle twitches, cramps, tightness, spasticity, weakness, and then it'll work its way throughout the entire body. The other one is called bulbar onset, and it starts in a person's neck or in their throat. And it starts in the same way in terms of the muscle twitches and weaknesses, but it starts in either the neck or the tongue. And it starts with perhaps some slurred and nasally speech. It leads to people having difficulty in chewing or swallowing. And then this type of onset often leads to a production of excess saliva. ALS, unfortunately, is a diagnosis of exclusion, and what that means is there is no one definitive test that will lead to an ALS diagnosis. Often, a person will present with a symptom and it will be misdiagnosed as something else, and often it can take 12 to 15 months from a person's initial symptom onset before they receive the official ALS diagnosis. Other diseases are ruled out by a few different types of tests. Sorry, somebody is in the waiting room. Hold 1 second. There we go. And then there is a familial onset. 10 to 15% of folks living with ALS have a family history of it. So doing genetic testing is important as a way to help determine whether or not the person has ALS. And Beth was the wife of one of our members. She passed away in January 2022, and we use this slide as an example to show why early diagnosis is important and how long a typical diagnosis um, road takes. And this is pretty typical of what most people will experience. So she started having some tremors in her hands and some odd falls in 2017. And that seems to be one of the prime indicators that something is wrong when people start falling a lot. She had some noticeable hand and weakness in mid 2018. She received a carpal tunnel diagnosis, which is the number one first thing that people who are presenting with ALS usually receive as a carpal tunnel diagnosis. She had a surgery for that in February of 2019, and then she received a second incorrect diagnosis of cervical stenosis in 2019, and then she had another surgery in 2019, none of which was helping or correcting the situation. And then as it was getting into 2020, she was still experiencing some problems. There was still no neurological referral. So in March of 2020, she and her husband went and sought their own neurological consult. And within 15 minutes, the neurologist said this is absolutely ALS. And this is a very typical road to what people experience. My person, Kurt, when he was going through diagnosis, he was misdiagnosed with many things, one of which they said he could have some rare brain cancer that was causing all of the issues. And as they were getting further and further along in the diagnosis, at that point, he was praying that it was cancer because at least he would have had a fighting chance. And so you'll hear that a lot when you meet folks living with ALS, that they go through these horrible misdiagnoses. Upwards of 30% of folks who eventually do receive an ALS diagnosis go through at least one unnecessary surgery, which is pretty heartbreaking. Why this is problematic and why early diagnosis matters is because the earlier somebody is actually diagnosed with ALS, that gives them a better chance to get into clinical trials. They can start any of the medicines or therapies that are available. They may want to start accomplishing and checking off things on their bucket list, if you will. And then again, they can find amazing support groups like we have here at IMALS that can help support them. What we have found is that folks, when they get diagnosed very late, you'll hear that they were diagnosed and then, within a few months they pass away. So they never even had a chance to live with the disease that they have. We have one girl who is the caregiver for a family member. Her poor brother went through 3 years of being sent to rehab centers because they thought, oh, he's going to get better. If we just give him some physical therapy, he's going to get better. And he was finally diagnosed with ALS, and he's to a point where he can't communicate anymore, and it's too late to do anything like provide eye gaze support or anything like that. So it's pretty devastating when somebody goes through that long process of diagnosis. The typical progression of ALS looks like this. However, no two ALS patients progress at the same speed or at the same rate. And we've got folks who have lived with ALS, like Mickey, for over 20 years. We've got another gal on our team who has been living with ALS for 21 years. We also hear that folks that get diagnosed, their typical progression is 2 to 5 years. It keeps changing before they pass on. But for every 10 people diagnosed with ALS, 50% will die in 3 years, 90% will die within 5 years, and then there's that small group of folks who may last more than 10 or so years. And so you can see the progression pretty much follows the early, middle, and late stages. But again, no two patients are going to be the same. And that's really important to understand, especially if you're going to be a caregiver or a healthcare provider, because how you deal with Will, for example, may be very different than how you deal with Mickey and how you treat Mickey and the symptoms that she has or he has. So this is really important. There is, again, is the familial or the genetic ALS, and this means that more than one family member is affected by ALS, and this is why that genetic testing is so important. We see this time and time again. Here's an example of where the Moore family has experienced this generational trauma of ALS that is just going through their family. This slide, I believe, is a year or so old, and they lost 7 of their family members. And two of them are living with ALS. And so, again, that's why the prompt diagnosis and that genetic testing is so important. The treatments for ALS look a little bleak. So, in 1869, ALS was identified. In 1941, Lou Gehrig died. There was no treatments developed or anything going on between that time period. Wasn't until 1995 the first drug came onto the market, which survives survival only by a few months. Nearly 20 years later, the next drug was introduced that, again, just slows down the decline. And then in 2022, a new drug came on the market, but it was pulled off the market because it failed in the phase 3 trial. So this again is pretty sad. And I think about Lou Gehrig. If he was diagnosed today, nearly 100 years later, he would have no better prognosis than he did 100 years ago. And that is very sad for our folks living with ALS. And then just a couple things I wanted to point out. So unfortunately, there was no reliable data, national data, to show how many folks in an assisted living facility or a long-term care facility are living with ALS. But if we look at the data, there's approximately about 30,000 people living with ALS at any given time, with that 6,000 or so new diagnosis annually. Between 800 and 820,000 residents live in about 30,000 facilities across the nation. So we can make it a reasonable presumption that includes some folks living with ALS. And so again, that's why this is such an important discussion to have tonight. Most facilities are not equipped with ventilators, feeding tubes, basic care things, trach care, to help take care of ALS patients. There is often no staff that has any ALS specific training. And so that is why we're here tonight, to help you get some of that training. And our amazing panelists are going to help share some of that information with you. And then lastly, before we kick it over to Kendra and the team, one of the things that is so important to our ALS community is the Sandy Morris was one of our amazing advocates. She passed away in 2022, but she left us with this amazing Morris ALS principle that just basically says nothing about us without us. That means that the person living with ALS should be part of every conversation that has anything to do with them. So when we're thinking about healthcare professionals, research community, legislators, policymakers, community members, any other person that's around them, that they want to be part of that conversation. As I said before, very, very few instances of ALS result in somebody losing their cognitive abilities. So even when the person has lost their voice or lost their ability to communicate, they still want to be part of the conversation. And so that is such an important piece of information to take away. And we'll talk more about that when we go into our panels. Just right before I give it over to Kendra, these are some of our amazing advocates and people living with ALS. We have Lori Carey. She's the individual I mentioned. She's been living with ALS for over 21 years. She has an amazing podcast called I'm Dying to Tell You. She interviews folks who are living with ALS, caregivers. She's interviewed Dr. Bedlack, who's pictured here. If you don't know Dr. Bedlack, he is an icon in ALS research. He's also a fashion icon. He has an amazing wardrobe. He talks about how he wears these outfits because they inspire joy and hope in his patients when there's not a lot of joy and hope associated with ALS. Mary Grace Porter, she just won a gold medal in rowing at the 2025 Invictus Games. She is also living with ALS. And then Andrea Little Pete has competed in marathons at all 50 states, and she has an award-winning documentary where she talks about her experiences. So I am going to stop this. And I am going to see if anybody else is in the waiting room. Nope. And then I am going to hand it off to Kendra and our amazing panelists. And again, if you have any questions that you want her to ask or you want us to ask our panelists, you can put them in the chat. Or again, we'll have time toward the end where you can ask questions yourself. Kendra, it's all yours.
Thanks, Kirsty. Hi, everyone, and thank you so much for joining tonight. We are going to kick this off with the basics. The first question is, for the panelists, of course, in your experience, do most long-term care facilities provide caregivers who are skilled and educated in ALS-specific care? If that's not the case, are these facilities generally open to providing additional training for their staff when they lack ALS-specific knowledge? And we can start with Cynthia.
Okay. In my experiences, many healthcare facilities and caregivers lack understanding when it comes to caring for patients with ALS. Many don't have sufficient knowledge about the disease itself, which likely makes it harder for them to provide specialized care that ALS patients require. ALS care has its own unique set of challenges, and training staff and caregivers is critical for providing quality care. Number one, ensure staff and caregivers understand the progression of ALS and symptoms and how they impact daily living. Communication. Teach effective ways to communicate with ALS patients, especially if their ability to speak and move decline. Emotional support. Emphasize the importance of empathy, emotional support, and active listening. Any questions?
What is he doing? Okay. Will?
Okay, hi everyone. So, in my personal experience, unfortunately, it's really not the norm for most long-term care facilities to have staff extensively skilled and educated in ALS specific care. And this is the reason why. ALS is rare. Many general long-term care LTC facilities may not encounter enough ALS patients to develop deep specialized expertise across the entire staff. Caregiving training and most long-term care settings focus on common conditions in the elderly, for example, dementia, stroke recovery, or patients with mobility issues. So while these skills are fundamentally are foundational, they often don't address the unique and rapid progression challenges of ALS. CNC ALS care is incredibly complex and it evolves quickly throughout the person's journey. Caregivers will need additional skills when coming into a nursing home. And Cynthia said this earlier, respiratory management non-invasive versus invasive ventilation, people dealing with communication issues, mobility, and transfers. Some caregivers aren't feel the transfer in certain facilities that I've been into. They actually learn when they get on the job. Swallowing difficulties. So most people may come into a nursing home where they are able to eat, but then eventually they lead to a feeding tube. So caregivers have to know the aspect of feeding to management. Um, as Cynthia talked about emotional and psychological support, um, in addition, pain management. There are a lot of issues that ALS patients deal with, and a lot of caregivers really have a lack of knowledge when it comes to dealing with patients. So in summary, I would say the majority of all long-term care facilities do not automatically provide caregivers who are deeply skilled and educated in ALS specific care.
Thank you so much, Cynthia and Will. Did anyone have any questions for them? Okay. Darla.
Same question, or are we on a new one?
Oh, same question.
Thank you. Do most long-term facilities provide the caregivers skilled and educated? I'm going to say no. I'm in Idaho. When my husband started in like 2010, there were some people that just didn't have somebody to take care of them in the house. And what do you do with those people? They had to go to a nursing home. And in our area, and even though we're the capital city of Boise, we didn't have a facility that could take them. We had to take them over to Oregon. And so they had no place to go. Or they pretty much just have a substandard care and they die quickly because their care is just not there. Now we're evolving as COVID came, and now fast forward now, with the advance of technology, we have one facility here in Boise that has a whole wing that's specifically dedicated to be able to take care of an ALS person in a nursing home situation. And that's due to a tracheotomy. And that came from the VA. They started putting tracheotomies in everybody, exhausted the caregivers. And here we had all these people that needed a place to go. And they finally had a facility that said, we're going to dedicate one wing to specifically to ALS. That would be the only place in Idaho that I would think an ALS person could go in Idaho, because we have a full-time respiratory therapist, which Cynthia can attest to is pretty important when you have a tracheotomy. But there's a whole set of skill set. Those people that come to work that facility, to work on that 15-bed, know nothing about ALS. And it is a crash course, and whoever's there to give them the skill set that they need. And that's here in Idaho, but I've heard that story many times. I know it's the same in Montana.
Darla, I too worked at the VA hospital. I worked at the VA in Loma Linda, California as a respiratory therapist. And then I started working with ALS clinic. And it was in the beginning in 2010, we started our first clinic. We had five veterans in there. They were all trached and vented and lived at home, had caregivers. They were offered 16 hours a day at that time. And plus then the spouse had to chime in too and help, the other hours. But I saw a lot of changes, a lot of things happen. In the beginning, there were so many holes in the system, and now I feel like they've gotten better. They too have a wing now for the patients to stay in.
Yeah, I think the VA for here is like plowing the ground. Like this facility is open to anybody in the community, which I thank the VA for that because we didn't have a clinic here in Boise, but we started that in 2015. I had a voice like no other. I wanted a clinic, ALS clinic. And from that, we evolved, and now we have a huge little, is evolved to where it is. But the community, if it wasn't for the VA and our little small community, there would be nothing for the ALS people at this point.
Wow, that's nice that they offered that up to them.
Well, it's in the community, so it's not within the VA. The VA had to do something with our veterans, and so it evolved in its own little way. But in the meantime, many people had nothing. So I can relate to that. But we took one of your really good speech pathologists, and she moved up here. I learned a lot from her.
Thank you so much, Darla and Cynthia. Looking at the systematic challenges, what barriers do long-term care staff face in confidently and consistently caring for residents with ALS? We can start with Will, and then if any of the other panelists would like to answer that question as well.
Okay. So, what barriers do long-term care staff face in confidently and consistently caring for residents with ALS? The long-term care staff face a multitude of barriers and confidently and consistently caring for residents with ALS. These challenges are multifaceted, encompassing issues related to training, staffing, aggressive nature of the disease, and emotional toll on caregivers. So here's some key barriers that I had noticed when I was living there. We had talked about this earlier. Lack of specialized training and knowledge. This alone does not exist in most facilities across the nation, but it does occur in about, I'd say about 80%. Staffing shortages and high turnover, especially since COVID. These shortages cause heavy workload for existing staff, and it's less attention to patients and cause rush care when patients are being seen. Most caregivers have burnout and there's a high turnover when nursing homes are trying to staff people. The nature of being a caregiver contributes to high level of stress, burnout, like I said, the turnover of long-term care staff. It's a vicious cycle for most nursing homes to maintain consistent care when new staff comes aboard. So it's very difficult for nursing homes. And the most crucial, I think, for difficult to having recruitment are low wages that's challenging working conditions. So yeah, caregivers in my area are maybe getting paid a little bit above minimum wage, and the work conditions that they have to face is just overwhelming. And most people, they tell me I can go drive for Uber or work for Chipotle and get insurance. And most of the home care facilities or nursing homes, they barely pay. So yeah. In conclusion, addressing these barriers require a multi-pronged approach, including enhanced skill training, like we have said, improved staffing levels, better consultation and support for staff, and a systematic focus on person-centered care for residents with ALS. Any questions?
That's so hard. Nursing homes they're not trained. I mean, the turnover is like Will said is so high, and they're often young and unskilled. And unless you have an advocate there to train them as they're coming in and out. My father was in he had multiple sclerosis, was in an assisted living for 20 years, and we were always training them. They were young, and my mom would come in and train them how to take care of dad, and then they were good to go. They left, and you have to start it all again. But for those that have nobody, it's their voice or there's nothing kind of thing. Then the facility that we have here, just as a perspective, if you're thinking about having an ALS go into a facility, they have one LPN and possibly two aides, maybe one aide for 15 people. And these people require 24 hours of care all the time. My husband was full care 24 hours a day, and he had constant care. There's no possible way a nursing home can really take care of a really advanced ALS person. And so realistic expectations needs to be set pretty hard when you go into a facility, and not unrealistically expect wonderful care. That's not the way it goes, unfortunately.
I have seen a lot of problems in these facilities. There's a big gap there for them, and a lot of it is they're that they don't know enough about the tools they need to help these patients. Like someone comes in and they can't talk, they bring their eye gaze in with them, but they won't allow the eye gaze in the room, so they can't communicate what their feelings are, and they have the caregivers have no idea what the patient needs, and then they won't allow their family member in to help them out either. It's just so many little things like that that need to change. They need to have some training and maybe even videos or something for the caregivers to watch before they go in and take care of an ALS patient.
Thank you all. Do any of the other panelists want to answer this question?
The only thing I can, as he was talking, when you're talking about wanting to train, when you offer to train the staff, then you're hit with the roadblock. You're hit with, no, Michelle, you just train the one that comes into your room, and you show them and hope. And I said, and you want to hopefully that they'll take what they've learned with me and transfer it over to somebody else. But yeah, I've even offered to train the people here, and I'm getting resistance. So I'm quietly going to just give them, Chris, we just finished Iowa with a pamphlet, and then of course, getting the PowerPoint from Chrissy. That is the only way that, if I can just get them in my room for 15 minutes, and while they're dealing with me, then they can see the PowerPoint, they can learn, they can ask questions.
I have done some training at some facilities where I asked if I could speak to some of the caregivers and the staff on how to care for an ALS patient. And I was successful in a few places, but they gave me one person to train, and that was useless. I mean, really, that one caregiver did get some training done, but it should have been more in there with her.
Thank you, Cynthia. Did anyone have any questions for the panelists?
No, it's not a question. It's a system problem because it's based on the staff that you have going in there with the ALS patient, I'm a caretaker for my wife for the past 5 years, and fortunately, in 5 years, we had two hospital visits, one for a a menineurovirus, and one where an aide actually pulled the tube out. And I mean, in the hospital system, one was a large university hospital, um, and the knowledge to work with an ALS patient, with the communication, everything we just discussed, is minimal. Only at one time, two of the nurses came back after hours because they were fascinated by the eye gaze device. They were there for at least another 2 hours after, wanting to learn. I think it's like if we go into the system, the people who are working in those environments, one, when they get their certifications, they're not trained in any of this stuff. They handle neurodegenerative diseases, ALS, Parkinson. And also, what's the motivation in the system to have them advance themselves where their compensation is so poor? I mean, you almost need to, like, if you could put together a tier level on certification where a person can get the training to handle, and I open it up to neurodegenerative diseases where they can make extra money or get paid appropriately if they have the training, or you need some type of certification certificate. I've spoken to in my journey over the years, I've spoken to trainers who work on it, who train on HHA. I walked away saying, well, there's part of my problem, the education to go in. So, I mean, you're asking for things, but the system doesn't want to pay the person to do that, but nor do the people see opportunities to advance themselves because they're not going to get paid for it. This is the society we live in today. And I feel like I'm bouncing off walls when you talk about it. But it's in my case, I think I'm above average educated on, the caretaking part there. Doctors, when you go, if God forbid you get transferred and you don't have an advocate into the emergency room, what's the first thing that the doctor's going to do if they're laboring for breath? They're going to stick an oxygen mask on you. So, I mean, I can go on the whole time here, but the general idea, I think, is what I just expressed. There's a system issue down there. And I think you need to look at a tiered level to motivate or give the opportunity to people to want to be able to learn and how to do that, do what necessary for proper care.
Thank you so much, Bruce. And continuing with systematic challenges, some of you have already kind of answered this a little bit, but if you would like to talk about it a little more, what are some of the most common misconceptions that facilities or staff have about caring for people living with ALS? If anyone had anything else to add,
Oh,
we can
yeah,
start with Will.
they always associate it with MS. You go into a facility, they're going to say,
Mhm.
"Oh, you have MS," and you're going, "No, MS is completely different than ALS," because they hear the word sclerosis. And I even outside, it doesn't matter who, they always say, "Oh, you have MS." No, we have ALS, and that's a real problem because they don't even understand the fundamental differences between the two, and there are huge. ALS is on steroids compared to MS kind of thing. And ALS people, I think that when we're going to facility, make sure they understand that. They'll say, well, we've had a couple of ALS people. We understand what that's like. The answer, if they say they've had a couple, they don't know nothing. People that have very little experience, to me, has nothing. And I start at the bottom to explain everything as we go along. So everybody that came into my team, into my life with my husband, I trained. They didn't know anything. But if they say they know something and they've been with it for one or two people, that's not experience, and that's a problem. In the nursing home world and in the money dollar end of everything, they'll say, "Yeah, we've had an ALS. Come on in." This means money to them, but they don't know how to take care of an ALS person. So I have to be real careful when they say, "Yes, we have experience," because I would really question that hard. And everybody ALS, that it could be bulbar, it could be a walking issue. Like Mickey, she talks really well, probably doesn't walk as well. Will has a breathing issue. It could be diaphragmic. So when they say, yes, we take care of an ALS, make sure they know your kind of ALS if you're going into a facility.
Thank you, Darla. Also, are facilities currently caring for residents with ALS, or are they looking to be proactive in preparing for future residents? And we can start with Darla.
Oh, that's a work in progress across America. Rural, you got nothing. Even in your bigger cities, it's a work in progress. You know, I see a glimmer of hope with what they've done here in Idaho. Boy, COVID just took everything back a step so far. But in some regards, it made it go forward, like healthcare within the house and having a team come into your home so you can take care of them in the home much better. That was not the case back before COVID. And so just having legislation and the insurances recognizing that home health care is much better for an ALS person than a facility is a way forward. But we have a long ways to go. My voice going forward for my husband and everything will impacted everything in my community. So if you're a person and you're caregiving and you can see an area that you can correct, that's one little area that you have done in your area. And before we know it, these little cracks are going to start being less of a crack. But it takes a strong voice. It takes a lot of energy. But I do see progress in the last 15 years.
How do you communicate that though to get through that, open that crack in the
Yeah, well,
community?
thank you. That's a great question. So my husband was a veteran, and he was at a community clinic that was very passive. What do you need, Darla? I don't know. What do I need? Well, whatever you need, we'll help you with. Well, I didn't know the question to give him an answer. They were really, really passive. You know, it's like, I don't know what I need. I don't know anything about ALS. I have to figure that out. But he was a veteran, and through a long story, I finally said, okay, well, let's go to the VA. I hear horrible things about the VA. And I went down there and I met everybody. There was one person that had ALS in our Boise VA, and that was it. And then here comes Dave and I realized that we could have a little clinic, an ALS clinic at our Boise VA. We didn't have to have a great big one like in California or Minnesota or Seattle, just a little itty bitty one. Couldn't be any worse than the one in our community. But I asked for 4 years, Bruce. I asked for 4 years. I asked everybody, my speech pathologist, my everything. But finally, we had a neurologist that came in, and I had the head of the pulmonology department said, you know, Darla, I think I can start a clinic. And on a little napkin, after 4 years of asking, my husband had ALS for 5 years. He was not doing well at that point. But we wrote down on a napkin what a clinic would look like in our little Boise VA. And in July of 2015, we had our very first clinic. That clinic, we only had about 5 to 10 people a year. And then it kind of grew, but it wasn't sustainable. So that little clinic now takes care of the complex diseases that veterans have. So now it's grown to a really big thing. So one little voice made a huge difference to my whole community that now I don't do anything for. But we also did from that little clinic, we started the whole ALS VA echo classes, teaching the people in the VA about ALS. And so her and I did all these classes once a month. I still go to this day. One makes a difference wherever you're at.
Yeah, I am ALS, and I jump on and off because I'm also the caretaker for my wife. But there's a presentation on for emergency EMTs and stuff, and I actually gave it to my diagonal neighbor's a former chief of the fire department here, and what don't you do that it says not to do, and the face drop. So, I mean, you have one document in there. I've only seen it once. And if someone can dig it out, it would be a great thing to share, even not just with EMTs, but just the aides, the caretakers. That document is very rich. You guys, IMALS has it. If you need it, just reach out to me. I do have a copy. I gave a couple of copies upstairs, which I've handed out. What to do and what not to do if you come in contact with an ALS patient.
Yeah, thank you for sharing that, Bruce. We definitely at IMALS, we have tons of resources that we can offer to folks. So I will put my email in the chat. So if you want to reach out to me, I can make sure that you get that document.
I have it.
Well, anybody
yeah.
else on the call that
Yeah.
needs it. And then we also have a huge network of volunteers. We have community support side where we actually have trained therapists. We have connections to get you the support that you need. So if you're here today and you're thinking, I don't even know where to start, I've been struggling, we can make sure that we get you connected to the right person. So if you want to send me an email, we also do, like I said in the beginning, we also do these panels specifically to,
Mhm.
like Bruce was saying, we could go into a firehouse, we could go into an EMT area and
Mhm.
present one of these panels where we give them the information. We cater each of the question series specifically to the audience. So when we have done a firehouse before, so all of the questions that we propose to the panelists are specific to a firefighter's work with an ALS patient. Again, we've done them with physical therapy students, so those questions are very specific to the folks who would be specifically working with the ALS patient based on
Mhm.
their profession. So we can provide all of those resources. So
Mhm.
again, if anybody needs them, please feel free to reach out. And then I saw Diane, I believe you had your hand
Yes.
raised. I also
Yes,
don't know how to raise my hand in Zoom, so I just stick my
I don't either, so I knew you'd see it. I want to know what happens, how caregivers and professionals, how they work with ALS patients around the world. What other countries, are there any that are more advanced? I know this isn't unique to the US. Are there any numbers or statistics or studies as to worldwide how many people get ALS? And where can we find out what is being done elsewhere? Because maybe we can tap into that. And I don't know where to begin, or I would do the research myself. So if
Yeah.
anybody can help with that,
Yep, Diana, I will definitely, I assume I have your email and the invitation
yes.
somewhere. So I will connect you with our care support side because they definitely have that information that they can share with you.
Really? Okay.
Yep.
Oh, that would be great.
And if
Okay.
and if they don't have it readily available, I trust that they can get their hands on it real quick.
Okay. So should I contact you or you'll contact me?
I wrote your name down, Diane, so I will
Uh-huh.
follow up with, I'll get your email from the invitation and I'll connect you with our care support side.
Thank you so much. Thank you.
Well, I want to just be respectful because we're coming up at 8 o'clock. We are scheduled to 8:15, but if there's folks that need to hop off because you've got only the hour, that's great. But I just wanted to give anybody else an opportunity if there's any specific questions. I know we have Michelle Camacho on here as well, who is a caregiver, and I want to make sure that Michelle, you get an opportunity to share your experiences as a caregiver. And I believe Kendra, you've got some final
Yes.
questions for her as well.
Okay. So Michelle, well, we're going to talk about how to approach the work, because that is the most important part, how we can work on this and make things better. How can we elevate the voices of people living with ALS as an essential resource for caregivers, not just as patients, but as teachers?
So for me, primarily, we need to put a face to ALS. They're not just patients, they're humans, mothers, fathers, grandmothers, grandfathers, sisters, brothers, doctors, lawyers, veterans, volunteers, people. It's a part of ALS is part of who they are. Unfortunately, I look at it as they were forced to retire from this because of this awful illness. They are still cognitively, in my experience, for my mom, she's still 100% there. She makes her own decisions with everything. She is part of her own plan of care. And the key is that as caregivers, we have to get to know the person before they were diagnosed with ALS. What what were they like? What did they do? Their career, their families, their hobbies, their quirks. And because that is part of their plan of care. Because if you go in with just, okay, here, I'm going to give you a bath, but maybe that's not what they like, it'll irritate them, but they can't communicate that clearly. it will make them very uncomfortable. And we also have to put ourselves in their position. They actually witness their bodies going from well maintained to withered and worn, and they can't do anything, from fully independent to so dependent they can't even scratch their own noses. And what else can they do? I go through, for me, and I think it's also imperative that caregivers learn that we should learn. They teach us, I should say, like my mom, she teaches me humility and grace, because how does it feel to have strangers come in to give you a bath, help you with your potty? And what is the level of anger that she has? She has to have it. She's human. What the sorrow dealing with this nasty illness, but for her, still find that smile to light up her room. She will do that. Everyone that meets her. And what we do to educate other caregivers through her is we have photos on the wall of her life before ALS. And what I do, when a caregiver comes in, I look at their reaction. Do they pay attention to those pictures? Do they ask questions about her? Or do they just do their, come in to collect a paycheck and that's it, cold? For them, there must be that level of empathy. Do they hold their hand? How does my mom react to them? And they have a lot to offer. My mom just cannot speak. So what does she want to say? So she can express in different ways. For her, her biggest thing, she expresses it in her smile. And I made a sign for her. My name is Monica. I have ALS. You can say hi, and I will share a smile. And because there is no step-by-step guide looking after someone with ALS, everyone is so different. And how does it feel to go from fully independent to permanently dependent, and where there's still no cure? And how can you sound off more? I use social media with her and we ask questions. So for her, we are also learning together and teaching others. I post about what she is going through, what others are going through, and so we learn from each other. So I call her an ALS warrior, because I can't do what she's doing and still go on with a smile. What gives her the reason to still want to continue and be happy and joyful given her current situation? And for us as caregivers, the bottom line is that we have to put ourselves in their position and listen. We have to listen and get to know that person.
Thanks so much, Michelle.
Oh, you're welcome. Any questions? And one other thing, I ask a lot of questions and I'm not afraid to push back for her. I am her voice. I speak on her behalf. And it's very important for my voice to advocate for her and teach others for her, because she cannot verbally express it.
And Randy just put in the chat, very valid points, Michelle. So thank you for that.
Thank you so much.
Thank you again. That was very important information to hear. Like what you're saying kind of reminds me of how I felt about taking care of my mom and how to make people see her as not just a person laying there. So thank you for that. So for the panelists, is there one positive thing you can share with us, a piece of advice? We can start with Michelle.
Piece of advice. My biggest is still, as long as you can, make sure there's a sense of normalcy. I put normalcy in quotes because for everyone it's different. We still go out with my mom. We take her last weekend. We actually were in Las Vegas because they're celebrating their 50th anniversary this weekend. She wanted to go, and that's where we went, and that brought joy to her heart. And it's very important that what she wants and what she needs is put as first priority. And we always have to remember that and put ourselves in her position, in their position. What would we do if we were just laying there being dependent on everyone? What would we do? How would we react? So we always have to have that at the forefront of our minds.
Thank you, Michelle. Cynthia?
I think somebody else brought this up. When you walk into the room or the home of somebody that has ALS, a lot of people don't look at that person. They talk to the family members. They don't include them in the conversation. And I think that is so sad. So I always make sure when I go to a patient's home that I am connecting with that person and including them in it.
Thank
Yeah,
you, Cynthia.
on my wife's Toby, the best conversation starter is what's the new gossip? And that gets the people going in the room when they're there. So that seems to be the conversation starter, and it just tails off.
That's great.
Oh, it's
Thank
working great.
you. Will?
So what's some good advice? Um, I would say finding finding caregivers that are generally caring and have the willingness to learn and adapt to your situation is very key into your care. It can go nursing homes or home care agencies. In my experience, all the caregivers are trained as a trained from scratch. So there is no way of finding someone that's going to know your care the way that you are taken care of. Every ALS patient is different. Our suction is different from somebody else. Some people may want to have their suction start at the end. I'll hold the button down because I like to have some deep suction. So every person caring for you is going to have to learn to adapt to you. So once you find caregivers that know you, I mean, um, Monica, you had talked about that. Having caregivers know, is it Michelle? I'm sorry. Having caregivers know who you are from the beginning is crucial because now they have a sense of being family. All my caregivers and nurses are family to me. And I think it's crucial that, finding someone that has your back um, is much needed in someone's care.
Thank you, Will. Mickey?
Well, I think I'm gonna take a little bit from everybody, except to say educate, educate, educate. That's all we can do. One more person that's educated, hopefully will train one other person. And be passionate about who you're caring for. Um, even here at this second facility that I'm at, I've already got close to one of the caregivers here. She's young, 19 years old, but boy, does she have an old soul, and she can take care of me. I don't have to say a thing. She knows my routine backwards and forwards, and is very observant. So with that, I say, just keep finding those people. And I'm sure maybe 1 out of 20, 1 out of 10, will be that one angel that's going to stick around and learn how to take care of them.
Thank you, Mickey. And Darla?
Well, I'm going to speak from a caregiver perspective, or whoever the strong advocate is that's taking care of an ALS person. And I have a simple formula that I used for myself, and it really worked well for 13 and a half years. And that was, I had to get proactive in the care for my husband. It is a complex disease, so I had to get proactive. I got prepared. If you're going to go into a nursing home, get yourself prepared to start interviewing now. And you have to be flexible, because before you know it, you're going to already change your thing. But all three of those together led to one thing, and that is simplest is best. You can get as complex as you want, but start simple. And as they learn simple, you can get as, but I got so tired that even the simplest truly in the very end was all that I could accomplish after 13 and a half years, because I was pretty tired. But I want to end on a story, because laughter is so fun, like Michelle was saying, with joy and everything. I think with ALS, I don't think people realize how funny and how much fun we really have. And I'm going to end with a story with my son. And he's just a funny dude. And my husband, he needed to be fed finally with a spoon. And I knew it overwhelmed my boys. I go, oh my gosh. So I fed my husband with a spoon. And my boys were going, oh my God, Dad's dying. Mom's feeding him. I go, well, no, Dad just needs to be fed. And they got used to that. And here comes Thanksgiving, and I was busy making a meal. So I said to my youngest son, Dane, would you mind just feeding your dad? It's been like 3 months. Dane, would you feed dad for me while I'm in the kitchen? And he jumped up and he ran like a gazelle around the table to his father. And he said, I've been waiting for this moment. I go, you have, I mean, now we're not eating nothing. We're just seeing what he's waiting to do. He goes, okay, Dad, don't worry, I got this. And he took a spoonful of food. He said, okay, Dad, open wide. And he played choo choo, choo choo. And he tried to play the little engine to get that in the mouth. And of course, we're all laughing so hard he couldn't get anything. So I flunked my son from feeding my husband. There are many moments where we just do nothing but laugh. And that was, those memories are precious to me.
That's a great story, Darla. And
Thank you,
thank you so
Darla.
much thank you for that joy as we round up. We're right at the end of our time. So Kendra, thank you so much for moderating this panel tonight. I feel like I messaged Kendra on the side. I said I feel like we could continue going for another hour. So thank you so much for this. We may be looking at a part two. I don't know. It feels like we have so much more to talk about. Thank you to our amazing panelists and to everybody who was able to join us tonight. And again, if you have any follow-up questions, again, my email's in the chat, but it's just Christy, CR at iamals.org. So feel free to reach out to me. And if you wanted to connect with any of our panelists, if you want follow up, again, just email me and I will get you in contact with them. But again, thank you so much, everybody, for joining us tonight. And Mickey, again, thank you so much for getting this organized. And we did record the session, as I said, and we will share out the recording. We'll send it to our communications team, and they'll put it on YouTube, and it'll be out on our YouTube channel very soon. And we'll send that link out to you. So thank you, everybody, and I hope you enjoy the rest of your evening.
Thank you. Bye, everyone.
Bye.
Bye, everyone.